Hi, my name is Chris Winder, Research Analyst with the Infotech Research Group. Today we're going to be talking about mobile device management in healthcare. One thing that is important to remember is that this is not only about the user, the doctors and the nurses, but it's also about safely managing the devices and the data that they're holding on these devices. So the problem is minimizing the time that's spent to get the proper bedside management for patients. This is a very complex problem, but it also brings in a secondary issue. The issue is consumer devices in the healthcare space. The problem with bringing your iPhone or your BlackBerry or even your iPad into the patient's room is that iPad or smartphone has been everywhere that you've been. It's had the possibility of seeing every bacteria that you've seen. Now, while this is an IT's problem, it can be the source of an IT solution. So the way that IT can understand how biosafety can be used to manage their problem is by understanding the biosafety problem. The biosafety problem in this case is that because doctors are in general so busy, there seems to be a lack of hand washing, and there seems to be a great contamination of cell phones and iPads that move between patient rooms. This creates a significant problem and introduces an extra variable to the doctor-patient interaction. In this case, the doctor is now the source of contamination. Many biosafety experts understand that hand washing should be used, but very few are willing to tackle how to deal with cell phones and tablets in the hospital workspace. This does, however, provide a perfect example of how, in a well-managed situation, IT and biosafety can work together to get both of their goals met. For IT, it's managing what data is on each specific device, and for biosafety, it's managing that dirty cell phones and tablets don't go into high-risk areas. High-risk areas are areas such as the neonatal ward, burn units, areas where the patients are very susceptible to infections. The corollary is that in an IT environment, these are the environments where the doctors are the most overburdened and most likely to have minimal hand washing between. For IT, this is also the areas where the doctors need the data to get to them the quickest. Through understanding this and through working with biosafety, it's possible to leverage the two problems to come up with a shared solution. These synergies can be used to make sure that doctors and the administration above you understand that there should be a single solution that deals with both of these problems. One example of how to deal with these solutions is just to not allow the devices at all. To ensure that every device is not allowed on the network, and therefore the likelihood that a doctor or a patient even will bring these devices into your hospital is limited. The real problem is that this is not a realistic solution. Doctors are going to continue to bring the devices. Patients are going to continue to bring their iPad to watch movies. What can be done, however, is to create firewalls in the network and that minimize the ability to access data when in these high-risk zones. If you added an additional carrot, such as having in-house tablets or terminals that can allow patients and doctors access to the data at the bedside, then you can deal with the problem. While these complex issues are painful to talk through, bringing other departments on board can make your life easier, particularly when managing this unruly and complex environment. Thank you for joining me today. For more information, see our value-added piece on mobile device management in the healthcare space. Thank you.